This is a typical office. It's a place where you earn your living. Sometimes we have no control over our environment and our exposure to infectious disease from others. But in your workplace or school setting, you may have noticed that certain safety precautions are posted to guard against accidents. When properly followed, these safety measures keep thousands of employees and students out of emergency rooms. Most of us are familiar with safety procedures involving machinery and facilities, but what about disease and illness? Are there precautions we can take to keep from getting sick when we have to work in close proximity with lots of other people? It's estimated 39.5 million people are now living with HIV. 4.3 million more will become infected this year. And it's estimated that 2.9 million will die from the AIDS virus. Hepatitis B, on the other hand, is 100 times more infectious than the AIDS virus, and over 2 billion people worldwide are infected. That's 1 out of every 3 people. And it's estimated that 1 million people will die this year from hepatitis B and its complications. Are you doing everything possible to protect yourself, your employees, and family? The following instructional safety program is hosted by Dr. Stephen E. Larson, Head of Infectious Disease at RMC and a member of the Infectious Disease Society of America. This program was developed to protect you, your employees, and your family.
Hello, my name is Dr. Steve Larson. The main goal of this video is to provide vital education on these topics for administrators, employers, employees, and the general public. We need to know the basics about bloodborne pathogens and infectious diseases, including HIV, hepatitis B and C, and how they relate to schools, workplaces, and home settings. And we need to understand why and how we implement precautions. We need to know the laws concerning HIV and confidentiality of students, employees, staff, and private individuals. By the end of this video, you'll be able to define the terms bloodborne pathogens, HIV, AIDS, hepatitis B, and hepatitis C. You'll know how to identify the characteristics of HIV, hepatitis B, and hepatitis C, and how to describe the different modes of transmission of HIV, hepatitis B, and hepatitis C in the school, workplace, or home. We'll also give you the information you need to be able to do the following: to list the universal precautions necessary to avoid infection of contagious diseases, including HIV, hepatitis B, and other bloodborne pathogens in the workplace; to understand the emotional needs of the child, employee, or individual infected with HIV, hepatitis B, or C in the school, workplace, or home setting; and to explain the laws governing confidentiality and disclosure of the status of students, employees, or individuals with HIV or hepatitis B or C. Because the topic of bloodborne pathogen disease, especially HIV, involves highly personal and sensitive issues, it is important that we have an opportunity to discuss and better understand these diseases. To accomplish this, let's clarify what these diseases are and how they are transmitted. Both HIV and hepatitis B and hepatitis C are caused by viruses. The individual's HIV stands for Human Immunodeficiency Virus, and AIDS is an acronym that stands for Acquired Immune Deficiency Syndrome. AIDS is the advanced stage of HIV disease. Basically, HIV attacks the body's immune system, leaving it vulnerable to life-threatening infections and malignancies. The HIV virus can incubate inside the human body for more than 10 years and be spread to others long before any symptoms appear. People infected with HIV usually look and feel healthy and may not even know for years that they are infected. When symptoms do appear, they can be similar to those associated with many common diseases, such as swollen glands, coughing, fever, or diarrhea. These symptoms, of course, vary from person to person. Only a blood test can determine whether someone is infected with HIV. Hepatitis, on the other hand, is an infection of the liver caused by a virus in the blood and other body fluids of infected persons. Less than half of those who become infected show any symptoms of illness, and only about 5 to 10% of those infected become long-term virus carriers, but 50% of hepatitis C infections result in chronic infection. The symptoms of hepatitis B include fatigue, mild fever, muscle and joint aches, nausea, vomiting, loss of appetite, and abdominal pain. In some patients, their urine turns dark orange and their skin becomes yellow or jaundiced. Unlike HIV, a highly effective vaccine is available to prevent hepatitis B. The hepatitis C virus attacks a different part of the cell than hepatitis B and is less likely to be transmitted by sexual contact. It carries many of the same flu-like symptoms, but is most often silent and more frequently results in liver damage. Now that we have a basic understanding of these diseases, let's look at how most people get them. One common mode of transmission for HIV virus is unprotected sex with someone who is already infected with it. That includes oral sex, vaginal sex, or anal sex without a condom. HIV can also be transmitted by sharing drug needles or syringes with someone who is infected with HIV. The virus can also transfer from an infected mother to her baby during pregnancy, childbirth, or through breastfeeding. HIV might also be contracted through infected blood or certain blood products used for transfusions to treat diseases such as hemophilia. But the possibility of becoming infected with HIV virus through blood transfusions in the United States is extremely low because since 1985, all donated blood has been tested for the HIV virus. The HIV virus cannot be transmitted or spread by a cough, a sneeze, through the air or water, or on surfaces like telephones, doorknobs, office equipment, or tools, or by using drinking fountains, toilets, or sinks. We have found no documented transmission of HIV through biting or kissing. Hepatitis B can be spread by sexual activity involving semen, blood, or vaginal secretions. It can also be contracted through the use of infected unsterile instruments or such activities as tattooing, body piercing, or even shaving. Other ways you can get hepatitis B are sharing IV needles or syringes with infected persons, direct contact with infected blood on your mucous membranes, such as inside your mouth or nose, or in your eyes, direct contact of infected blood on broken skin, which could include cuts and scrapes or accidental needle sticks, sharing toothbrushes, being born to an infected mother. Although the spread of hepatitis B through a school, workplace, or home setting may occur occasionally, it is not common and is usually only a concern in special education settings and classrooms, which may be attended by students who become infected or chronic carriers while in hospital or residential facilities. HIV, hepatitis B, and hepatitis C are frequently transmitted through specific behaviors like sharing intravenous equipment, which is a major cause of infection. Risk of infection is very low in the school, workplace, or home, since the incidence of this type of behavior is minimal in these environments. The primary risk of transmission of HIV or hepatitis in the school, workplace, or home setting is with direct exposure of infected blood or through broken skin or mucous membranes. Although unbroken skin is an extremely good barrier to these viruses, we have developed a set of universal precautions that are strongly recommended. These are hygienic measures used to prevent the spread of all infectious diseases, and they certainly apply to HIV and hepatitis B and C. Universal precautions assumes that anyone could be contagious. The universal precautions should be applied whenever possible to the school, workplace, or home setting. They include frequent hand washing, the use of latex gloves and disinfectants, hygienic trash disposal, and modification of procedures used in cardiopulmonary resuscitation or CPR. Your facilities for hand washing should include a sink with hot running water, a liquid soap dispenser, disposable paper towels, or an automatic warm air hand dryer, and waste receptacles with disposable plastic liners. Hands should always be washed before any of these activities: eating, drinking, smoking, handling cooking utensils or implements, preparing food or assisting with feeding, assisting with toileting or diapering. That's before, but you should also wash your hands after the following activities: Close personal contact with students or coworkers, especially those with nose, mouth, or ear drainage. Contact with body fluids such as respiratory secretions, blood, including menstrual flow, urine, feces, mucus, or drainage from wounds. Removing disposable gloves, using the toilet. One universal precaution we mentioned is the use of disposable latex gloves. Gloves should be immediately available in the work areas, and they should be used only once. Gloves should always be used when handling blood or body fluids. And a new pair of gloves should be used whenever hand washing is indicated. Gloves should always be discarded in a waste receptacle with a plastic liner. Another universal precaution is the use of disinfectants, such as household chlorine bleach, which is effective against most disease-causing organisms, including HIV, hepatitis B, and hepatitis C. The chlorine bleach should be in a 1 to 10 water solution. For example, 1/4 cup of bleach mixed into 1 gallon of water. This solution should be changed daily. Other disinfectants approved by the Environmental Protection Agency are also effective. Correct disposal of trash is another universal precaution. You should have separate containers for trash containing blood or body secretions that may contain blood. The containers should be marked appropriately and lined with plastic. Puncture-proof containers are required for needles, syringes, or lances. Don't break or recap needles. Place intact syringes with needles into the correct containers. Then contact your local health department for disposal of contaminated material. The last universal precaution is the modification of cardiopulmonary resuscitation. CPR should always be started as soon as possible because delay could jeopardize a successful resuscitation. However, whenever possible, we advise the use of masks or shields to prevent the black flow of fluid from the mouth of the victim to that of the resuscitator. These masks and shields or other devices should be accessible to any person likely to be required to administer CPR in a school or workplace setting. In addition, students and employees should always be instructed in the safe use of playground, workplace, and laboratory equipment to minimize the risk of injury to themselves or others. Remember, open wounds invite infectious diseases. So now you know what these viruses are, and you know the universal precautions and procedures to prevent transmission of HIV, hepatitis B, and other infectious diseases. But as administrators and employers, we should now learn how to be sensitive to the needs of all infected individuals, particularly children with HIV, hepatitis, or other diseases in the school, workplace, or home setting. You may have seen media reports about the treatment of children and individuals who are turned away from school or work because they've been infected with the HIV virus. Now we can take advantage of our newfound knowledge regarding infectious diseases, the modes of transmission, and how to prevent them. And we can examine how to deal with the HIV-infected individual in a school or workplace. We're going to consider a few example situations that you could encounter or may have already encountered. We're going to use examples in a school setting, but they can also apply to the workplace, home, and other settings. First, imagine that you've just received a call from your supervisor informing you that a child with a cold or flu will be attending class. In this situation, you would probably feel cautious because, of course, you know that flu and colds are contagious. Maybe you're a little angry at the position you've been placed in, but you accept it and prepare as best you can for the child's arrival. Now let's imagine a slightly different version. This time your supervisor informs you that a child with a terminal leukemia case will be attending classes. What are you feeling now? Maybe you're sad or feeling sympathy for the child. Maybe you consider how you can help the child, but you prepare yourself in a different way because you know leukemia is not transmittable. Now let's try an example for which you might not have a good answer yet. You receive a call from your supervisor informing you that a child infected with HIV will be attending class. Now how do you feel? Afraid? Angry? Maybe even a little panic? Yes, the HIV virus is infectious, but only if we don't follow the universal precautions. The child with leukemia is dying, and perhaps so is the child with HIV. Do we have the same compassion for the HIV child? The child with HIV, like the child with leukemia, did not ask for the disease. Both children deserve our compassion, concern, and support. Now let's imagine another situation that may arise. What if a parent who seems fearful and angry calls your school because she's heard that a child who has AIDS is attending school? What would you do then? A mother's instinct to protect her own children is understandable, but perhaps you could remain calm and let her know that while any information about a child who may have HIV is confidential, the entire school staff always follows what are called universal precautions. Inform her that in any case there is very little possibility that HIV or AIDS could be transmitted in a school setting. The child with HIV not only deserves our support, but also our confidentiality. The law states that information regarding HIV or AIDS may only be shared with individuals specifically named by the child's parents or guardian. Adults over the age of 17 are allowed to grant or withhold their own written permission to share their HIV status. Sharing information about HIV or AIDS in an infected person without consent is prohibited by law, and violators are subject to civil penalties and a fine up to $5,000. Another situation you may encounter is instigated by gossip. Many people become fearful and talk about things they don't understand. What if someone you work with tells you that so-and-so has tested positive for HIV? What do you do? Remember, the confidentiality laws apply to this kind of situation as well. Inform your colleague that HIV status is confidential and protected by law. Urge them not to speak carelessly about it, because depending on the harm that may occur, someone could be fined as much as $5,000 for sharing information about someone else's HIV status. Appropriate school or workplace policies for students and employees with HIV or AIDS should state that students and employees may not be excluded solely because of their HIV status. Only a physician may determine if school or work attendance is inappropriate due to the student's or employee's vulnerability to infection at the school or workplace. Also, current law does not require parents, employees, or physicians to inform school officials or employers of the student's or employee's HIV status. Remember, even if disclosure by a student, parent, or employee is made, it must be kept confidential unless written permission is given by the parent, guardian, or the adult individual to do otherwise. It's also a misdemeanor to disclose blood test results of HIV positives except by written authorization. In order to comply with these laws and procedures, legal counsel and policy development or review is essential. Ideally for students, a policy development team would consist of some combination of parents, representatives of the certified and classified employee associations, the school nurse, school board members, administrators, public health authorities, the media, personnel director, and legal staff members who can provide information about policy development or review. School personnel and parents need to know the policies that have been developed. The basic concern is in balancing the rights of the infected person with the rights of the uninfected persons in every school or workplace setting. In 1992, the Occupational Safety and Health Administration, or OSHA, issued regulations to help employees who may come in contact with bloodborne HIV, hepatitis B, or other bloodborne pathogens in their work. School districts are responsible for ensuring that employees who have exposure to blood or body fluids receive extensive annual in-service training about safety procedures, policies, and reporting of this exposure. Districts must also provide access to a preventable hepatitis B vaccine at no cost to its employees. In the school setting, employees whose jobs pose a hazard of exposure to infectious materials include designated first aid providers such as nurses and instructional staff working with students who have lived in a group home or institutional setting such as the developmentally disabled. The OSHA regulation arguably could be extended to include employees who have an occupational duty to respond to an incident involving first aid. This would cover all classroom teachers, bus drivers, playground supervisors, office staff, and those involved in physical education and recreation. However, the pre-exposure, in-service, and vaccination standard does not apply to occasional Good Samaritan actions that result in exposure to potentially infectious materials, nor does it apply to students. Athletic program staff concerned with policies about sports injuries should refer to their state's interscholastic athletic federation. Here's what the latest OSHA regulations say about school districts. A pre-exposure vaccination to hepatitis B is required for employees who are designated by the school district as first aid providers at a first aid station or who are likely to be exposed to pathogens from selected students, as mentioned earlier. Vaccinations may be made available through the Public Health Department, private medical practitioners, and/or the school district's preferred healthcare provider. The option of post-exposure prevention measures, including a hepatitis B vaccination within 24 hours of exposure and medical follow-ups, is authorized for employees who may have accidentally been exposed to someone's body fluids, even if the employee's routine work assignment does not include administering first aid. State health and safety codes have required that all school district employees receive information regarding the possible transmission of HIV, hepatitis B, and bloodborne pathogens, including information on universal precautions and confidentiality. This information is to be provided annually or more frequently as new information arises. If all school employees are receiving information in accordance with this code, OSHA requires that additional information be provided to employees in the designated occupational exposure categories. This information would be communicated during in-service training as a supplement to the basic information shared with all district employees. Designated first aid providers shall also be trained in the specifics of reporting first aid incidents which involve potentially infectious blood or body fluids. The district should determine to whom the exposure should be reported and how the exposure incident should be followed up. According to OSHA regulations, the following must also be in place: personal protection equipment for school nurses such as latex gloves, housekeeping policies and procedures such as plastic trash liners and accessible disinfectants, hepatitis B vaccination availability with post-exposure evaluation and follow-up. In the event of a bloodborne pathogen exposure, the district will maintain the confidentiality of the infected employee and the exposure source during all phases of the post-exposure evaluation. The district shall provide appropriate personal protection equipment at no cost to the employee and also make sure the employee knows how to use the protective equipment. A bloodborne pathogen in service offers several benefits to a school district. Because it meets OSHA requirements, it lowers the school district's potential for workers' compensation claims and therefore lowers insurance rates. It could reduce medical and disability costs due to the use of universal precautions and vaccinations. And the district also benefits from increased productivity due to the loss of employee downtime from illness or accident. An employee or school district shows it cares about the health and safety of employees when it promotes health and safety standards in the workplace. And that can boost morale and cooperation between the employees, unions, and administrators. Businesses and school districts may obtain copies of OSHA regulations by contacting their state's OSHA offices or going online to www.osha.gov. This video was designed to give you a better understanding of HIV, hepatitis B, and other infectious diseases, as well as the laws pertaining to them. If you would like more information on HIV/AIDS or hepatitis B, contact your local chapter of the American Red Cross or call the National AIDS Information Hotline at 1-800-342-AIDS. We can set a legal and compassionate example through support and understanding for those who are infected with HIV, AIDS, hepatitis B, or hepatitis C. To be informed is to be empowered. Thank you for staying informed.